Pathogenesis of acid-base disorder. Metabolic acidosis, that's the first basic type of simple primary acid-base disturbance. Metabolic acidosis, primarily the bicarbonate ion level drops. And bicarbonate ion is a type of acid or base. Yes, it's a type of base. When the base level drops, it means we have extra acid, so we got acidosis. The acids increase, and fixed acid increase, and source increase, and exclusion drops. These are all reasons that can cause metabolic acidosis. Source increase, for example, lactic acidosis and ketoacidosis, it generates more, and salicylic acidosis is excessive intake, and exclusion decrease, for example, from renal failure. You cannot get rid of the extra acid. So on contrast with comparison, the bicarbonate ion level appears lower than the acid. And the base, I've been talking about the increased acid and the decreased base. Compare the two, we get more acid, so acidosis. And we talk about the factors that are related to the increase of acid. Now, I'm showing you here the reasons that, or the causes that can lead to the drops of bases. Source decrease. And normally it does not happen. And the increased loss from GI system, for example, from all the runs, diarrhea, or even vomiting, from kidney, proximal or distal tubular acidosis, we call it, and consume too much. Ammonium chloride have been administered. That's one of the reasons cause the consumption of base increased. And metabolic alkalosis, that's the other one of the pair of metabolic caused acid-base imbalance. It's a primary bicarbonate ion increase. And the reasons to cause this are totally opposite. We have fixed acid drop and bases increased. All the reasons that lead to the fixed acid drop can be from GI, vomiting, gastric suction, from kidney to cause more loss, potassium and chloride deficiency, hyperaldosteronism, Cushing's syndrome, diuretic therapy. It's fixed acid decrease. And the sources or the reasons that can cause the increase of bases are the source increase, for example, alkali administration, and the exclusion drop. Normally, it does not happen clinically. And the third type is respiratory acidosis, primarily what increase? Primarily what increase? Hydrochloric acid increase. Hydrochloric. Carbonic. Carbonic acid. Carbonate acid. Primarily primary carbonic acid increase. Sorry, not hydrochloric acid. Hydrochloric acid is located in your stomach. And what can lead to this? What can lead to the volatile acid increase? Generation increase normally does not happen. And exhalation drops, failure of ventilation, and inhalation. Inhale carbon dioxide at high concentration. Fail to exhale carbon dioxide and plus inhale extra high concentrated carbon dioxide, which lead to the increased carbon dioxide level in our system, and it joins together with water to form extra carbonate acid. And when it comes to respiratory alkalosis, the situation is the opposite. And please pay attention to how the volatile acid level is dropped. And what are the effects of acid-base disorders? What are the effects of acid-base disorders? And we will separate it. We'll separate acidosis and alkalosis and explain them respectively. And the first one, what can acidosis to the respiratory system? The first effect is hyperventilation. We call it Kussmaul respirations. And it's increased breathing rate and increased depth. And cardiovascular effects, depression of myocardial contractility. So your heart is not contract properly. And this effect will predominate at pH level is less that low, which is close to 7.2. Sympathetic overactivity, and tachycardia and vasoconstrictions, and decreased arrhythmia threshold. And the other effects to cardiovascular system are resistance to the effect of catecholamines occur when acidosis very severe. Peripheral arterial vasodilation and vasoconstriction of periphery veins, and vasoconstriction of pulmonary arteries, and effects of hyperkalemia on heart. And these are all effects that acidosis can induce from the cardiovascular system. And the central nervous system effects. And what can acidosis do to central nervous system? Cerebral vasodilations lead to an increase in cerebral blood flow and intracranial pressure. And it's quite often to occur in acute respiratory acidosis. Very high carbon dioxide pressure will cause central depression. And other effects. We mentioned the most important one, heart, brain, and lungs. And other effects, increased bone resorption, chronic metabolic acid only, shift of potassium out of cells, causing hyperkalemia, an effect seen particularly in metabolic acid and only when caused by non-organic acid, an increase in extracellular phosphate concentration. These are some of the other effects. That's effect of acidosis. And with these effects, what kind of clinical symptoms patients will suffer? And the effects on respiratory system will cause increased rate and depth of breathing, like I mentioned, Kussmaul breathing, and coughing. And to the heart is arrhythmia, irregular heartbeat, and decreased heart rate. And gastric, nausea, vomiting, and intestinal diarrhea, cannot function properly, muscular seizures and weakness. And to the brain, can cause headache, sleepiness, feeling quite drowsy, confusion, loss of consciousness. If it goes worse, it'll lead to coma.